Bill.
Can you guys hear me? Oh, we're working. Yay. All right. We're going to go ahead and get started, everybody. All right. Thank you guys so much for being here. As you all know, we're here to celebrate our Innovations Award and our amazing scholars that are here today to present on either their upcoming projects that they just recently won award money for, or our past scholars who are going to update us on the progress that they've made over the last year with the money that they've received. This is a really exciting day, especially for our team, just because this has been something that we've been working forward to for the last 3 years that I've been on this team, that we've been working towards this point. It's been a goal of ours to be able to celebrate the scholars that we've been funding over the last couple of years. So just really a big thank you to all of you for being here and celebrating with us. We really encourage questions, whether it's about the Innovations Award and what we as a team do, our collaboration with the Alumni Association, or for our scholars as well. You're going to get a chance to hear from each of them about the work that they're doing or planning to do. And we do have time built in there for everyone to ask questions. And so thanks, we'll get started. All right. So before we jump into some information about the Innovations Award and what we do, I do want to give a big thank you to our planning committee, who's over here to the left and hiding from you all. So it's quite a big team. We would not be here today without each and every single person that you see here. So it's a good mix of people. We have folks who are a part of our medical student council, so medical students, including myself, Ava over there in the corner. We also have Josiah and Emmanuel, two of our new MS2s who've really taken the reins in helping us on the MSc side of things. And then we have some amazing faculty who've been with us along the way. So Matt Rastizzi is here. You guys probably know him. He's pretty well known. Unfortunately, Dr. Frank Reed, who is one of our alumni mentors for this project, is not able to be here today due to just falling sick, but we do miss him in person, but he is here in Zoom, I see. Hey, you made it. And then finally, I do want to give a big thank you to Noel Rodriguez. He did not last, we also have Vanessa, but Noel did a big part of helping us get today in order. And Vanessa is just continuously our guiding light when it comes to all things the Alumni Association and getting things like this funded, set up, telling us where to go to find the answers when we're trying to figure things out for the projects. So big thank you, Vanessa. All right, you guys are all here, so I know you already know what the Innovations Award is, but just for those who maybe aren't as familiar with it, this was an award fund that was started many years ago, over a decade ago, by the Medical Student Council to help fund projects that were designed and implemented by our medical students. The main purpose behind this program was to encourage students to think about the communities that we're getting our education in, our medical education in, initially thinking about the greater Aurora community and wondering about how we can make an impact in a positive way on this community that, we may be here for just a short time, but we're leaving behind more than we realize. And so with that, we originally received our funding from the Medical Student Council to start implementing these projects and start trying to foster activism in our medical student classes. Originally, and still today, the award is up to $2,000 to any students who wish to apply for a project. So it has now been expanded to go beyond just the Aurora community, because as you probably know, we have, other satellite sites now as a part of our medical school. We have students who are up in Fort Collins doing medical work. We have students in Colorado Springs. And now with the advent of our LIC curriculum, we're going to have students kind of all over the state. So we really do anticipate that as this fund continues to grow, that a lot of the projects and the scope of the projects will spread beyond just our Aurora community here. But amazingly, we've just had such success with the projects that we have been able to fund. Some of the more noteworthy ones that you see are listed here from the past. Actually, our Dawn Clinic was one of the original projects that we funded through this fund. The White Coats for Black Lives chapter initiation was a part of the Innovations Award as well. And so many more amazing projects that you're going to hear about today, as well as some of our upcoming stars. Something that I did want to also call out was that about 5 years ago, we branched into a partnership with the Medical Alumni Association here at CU, in large part thanks to one of our alumni here, Meryl. And really, we just felt that with the success that we were having with the Innovations Award, that more could be done if we had the support of our alumni. A big part of the goal for this partnership was to build on mentorship for our students who are engaging in these projects, because for a lot of us, it was the first time that we were doing this type of work, that people were writing for grant money, trying to design projects with not just an academic institution in mind, but also with community members and community partners who had different goals, different objectives, different processes. And that was something that a lot of us hadn't done before. And luckily, we have a really amazing alumni network who could help guide our students. And so with this initiation, we've started partnering each of our applicants who reach out and declare that they're interested in applying for the Innovations Award, and finding a mentor who's interested in their project, feels that they have something from their history, from their work, that could really contribute to what they're doing. And it's been really amazing to see how a lot of these mentorships have flourished, how the applications themselves that we as a committee are receiving have just significantly improved in caliber and the quality of what we're seeing. And it's been a really rewarding experience for all of us on our team and for the students and mentors who've been a part of it, and something we look forward to continuing. So before I keep rambling on, because again, it's not about us today, but about our students and hearing about their projects, I do want to introduce Dr. Taylor Triolo, who's going to speak a few words for us about the projects and about her partnership with us as a part of the Medical Alumni Association. Thank you.
Great. Thanks so much. So I'm Dr. Taylor Triolo. I'm a graduate of the class of 2013, and I'm the president of the CU Medical Alumni Association. And I'm so proud to see how far this initiative has come. And it's been really, really wonderful to be involved with this project for our board and for the students and partnering. And so in 2018, Dr. Rustici came to the Medical Alumni Association wondering about support for future student projects, because like Helene was saying, there were some funds there, but it wasn't sufficient for the vision that all of our awesome students had. And so since then, thanks to many of our generous medical alumni donors and benefactors, we've created the Innovations in Medical Education Endowment, and it's raised over $125,000 to support these futuristic projects, which is amazing. So yeah, kudos to that. We have a goal to get this endowment to reach $250,000, so that then it will spin off every year a minimum of $10,000 to support projects each year. So if there are any alumni here in the room or on the Zoom call tonight, if you're interested in helping support this initiative with a donation, we've placed a link in the chat on the Zoom, but then also on the flyers in front of your desk where there's a QR code that you can link to. But if you have other questions about how you might get involved, either as a benefactor or donor, reach out to me or to Vanessa Duran, who's the Director of Alumni Relations and Advancement in here, and who we couldn't do any of this without. So as Helene was saying, for everyone who knows Dr. Rustici, he didn't stop there just with the funding. He saw the greater vision to partner students with alumni and to bring alumni together to help students work on their grants, work on their projects, and like you said, really improve the grants that we were seeing submitted. So it's really been incredible to be involved in this initiative. And I also want to recognize Dr. Meryl Colton, class of 2019, who was really instrumental in this partnership, because we really couldn't have done it without yours and Dr. Rustici's vision just those few years ago. So thanks, Dr. Colton. And I'm really excited that you're all here tonight, and thanks to our board members that are here on the Zoom. I can see you guys. Thanks for coming tonight. And so I'm excited for you guys to hear more about the projects. Thanks.
All right, I'm Matt Rustasi, class of 2008. I think I got probably more fanfare than I should have there because I really just am here. But the students are the ones that are really doing all this stuff, maybe. I do work Zoom relatively frequently as well. So I just want to talk about a couple other options to get involved. We do actually a lot of great things with this Innovations Award. One of the things is we have proposal mentors. There's multiple people in this room who have done that as well as on Zoom. These are people who help our students learn to produce really high quality proposals. So a lot of our students have a ton of initiative and are really interested in becoming these amazing leaders in the future, but haven't done a lot of grant proposals. And so we're hoping that they, go through this process, get a lot of mentorship from experienced clinicians that are in our alumni group, and then produce these really fantastic proposals. Like the last few years have been like phenomenal. We vote on those. So as a global alumni body, we cast our vote to say which ones we think are the most important. And so those will come out this October as well. So when we get the new set of grants, we'll send those out to you as well. And then lastly, the donation piece is what I will show you a QR code for here. We want this day to really be about highlighting the programs. We've been so lucky to have as much money as we have. I think like the medical alumni board has been fantastic. So Linda Williams helped last year as our president, and then Taylor's taken it this year as well. And we hope that this will be a legacy that really the CU School of Medicine like gives for years to come, and that many of us that are here, especially the students, will come back in 25 years. And this will have like led to countless numbers of health innovations and really changed the way that our students have grown as leaders and have become these amazing people. So very excited to see where this thing goes into the future, and really appreciative of everybody's support in all the different ways.
All right, so before we jump into some of the presentations from our scholars, is there any questions about the Innovations Award itself, what we're doing? All right, speak now or forever hold your peace. Great. All right, that means questions only for the scholars moving forward. All right, so we're going to hear first from our newest winners. These are the folks that we voted on back in December and awarded the Innovations Award. Their cycle of applying this money began in January. And so they're going to speak a little bit more quickly about their projects, just because we anticipate that maybe not as much has been done yet. Just kind of tell us some of their goals, what their hopes are for their projects, and what they hope to achieve with the Innovations Award. All right. Oh, and I did the same thing as you. All right. So we're going to start with our project Bouquets to Bedside. You guys can come in.
Hi, my name is Aspen.
I'm Caitlin.
And we, along with our other co-student, Mackenzie Isbell, are the co-founders of the Bouquets to the Bedside project. Basically, what we do is we take flowers that were donated after weddings or different events that would normally just be thrown away. And we pick them up and make them into new bouquets, and then we deliver them to patients that are in the hospital.
It's a pretty simple project in idea, a lot more difficult in logistical planning, but our funding from the Alumni Association has made that a lot easier. I think do we click for slides or, oh, just kidding. Oh. We had some slides with pictures, but I guess you can see them here. So we've been able to do this twice now since we started with the funding, and both times were a huge success. We take these flowers to the Denver Health patients and we distribute them on the wards there, and we also give them to nurses and leave them at nurses stations. And it's been a great thing just to start creating community with our medical students and with patients and with the staff there at the hospital. And yeah, all of the funds help us to buy vases and to get these cards and to do this on a much larger scale. Because before, when we were doing this, we were beholden to anything we got donated from the events. And as you can imagine, people like to hold on to their hard goods like vases and things. And so now that we have these funds, we're able to use all the flowers and distribute this at a much larger scale. And so far we've done about 50 bouquets, and we hope to do this 10, 15 more times in the year and get up to like 300.
Thanks, guys. All right. We're going to go on to our group encouraging literacy and growth.
So hi, my name is Aditya. First, we'd like to thank the Alumni Association for funding this project. And our project is like effectively creating a collaboration between the CU School of Medicine and Reading Partners, which is a national organization, but locally here in Denver. And this project, the main objectives are to increase the volunteer base, as well as providing literature to these libraries to provide further healthcare literacy, in addition to representation among these groups.
Yeah, and just a little bit more context, Reading Partners is an organization that goes to sort of underserved Denver schools, identifying students that have fallen below grade level, and works with them to hopefully get them reading at grade level. And just on a personal note, having volunteered with them and worked with them, these kids have just incredible potential. They're very bright, they're incredibly curious. And we hope that our project, by bringing in books that feature healthcare professionals that look like them and allowing them to interact with students at CU, will hopefully inspire them to see a version of themselves that could be healthcare professionals. And I would think that's just an incredible benefit to our community as a whole too.
And lastly, if any of you guys are interested in volunteering with this organization, it's about 1 to 2 hours per week. And you go to like the closest elementary school is Paris Elementary right across the street. And you just tutor and you read to them and they read to you for about an hour.
Thank you guys so much. All right. Moving on to our Iraqi Migrant Health Project.
Hi, everybody. My name is Levine. I am a third year, almost fourth year medical student. Hi, everyone. My name is Aya. I am a bit of an enigma. I'll be starting medical school next door at RVU this fall. And Aya and I are here with the Iraqi Migrant Health Project. We're branding as IMHP. This project actually started as an MSA project a couple years ago. I got to see the initial creator. She was a fourth year when I was a first year. And now it's just completely expanded in a lot of different ways. Our personal goals and interests are to deepen our understanding of Iraqi migrant health and healthcare needs, experiences, and disparities in Colorado through research, and then to disseminate those findings and hopefully educate providers of the populations, and then transform that data into action in the community. To really emphasize that last bullet, transform data into action. At the heart of when we're collecting data and disseminating it, we seek to couple quantitative with qualitative findings and contextualize those data points, the statistics, with more human, colorful experiences. And I guess to backtrack just a bit, oh, sorry. Aya and I are both Iraqi immigrants, or I guess Iraqi immigrants who have a personal investment into the community, of course. But then this obviously is work that can be translated into a lot of different marginalized communities. And so we're very much passionate about that. What has been done, actually, I just got back a couple of days ago from presenting our latest study at the Society of Teachers for Family Medicine conference. You want to tell us about it? Yeah, so our last study focused on assessing the mental health needs, perceptions, and experiences of Iraqi migrants, a 16-person sample that went in deep with each of the participants of that sample. And right now we're in the stage of disseminating our findings to a diverse group of stakeholders, whether it be people in the government who are part part of the Colorado Refugee Services Bureau, to different providers, to people here at Anschutz, to students who maybe not have had exposure to the Iraqi migrant population in particular. And we've seen a lot of parallels between our findings and findings among Ethiopian refugees, even Afghan refugees. And it's all about the heart of our project, where you see like community building. The heart of it is creating these bridges between different disciplines, different stakeholders, to show that even just one population, their experiences connect to a lot of experiences among people.
And then what's to come is what the Innovations Award is going to be funding. So thank you guys so much for that. We're hoping to have a community building event and then subsequent events that'll connect the Iraqi Migrant Project with like community stakeholders, ultimately promoting social wellness based off of the data that we found in the latest study. So these community resources, this actual community collaboration that we'll have for the Iraqi migrants, all in like some really fun event that would be sustainable, ideally to continue bolstering their wellness.
Thank you all so much.
All right, and then up next is increasing awareness of resources for substance use disorder treatment here in Larimer County.
Hello, my name is Martin Maxwell. I'm an MS2.
I'm Jen Falker. I'm also an MS2.
And Caitlin Blades is our third member, but she couldn't be here today. And in retrospect, we should have thought of a more clever title. It sounded pithy in my head. But essentially, you know, all over the nation and in Colorado as well, we have a huge issue with substance use disorders, in particular opioid use and alcohol use disorders. And in Larimer County, we're part of the Fort Collins branch. We're actually really lucky that we have a pretty robust network of resources, including Summit Stone Health Partners, who is a large federally funded provider of mental health and substance use treatment. They actually have a very robust medication-assisted treatment program that's underutilized currently. And so our goal was, let's try and bridge the gap between a lot of the providers in our community who really, really badly want to help their patients who have substance use disorders, but often don't know where to send them, and often don't make referrals for fear that they're going to be cost prohibitive.
So far to achieve that goal, we presented at the annual Northern Colorado Medical Society meeting that was back in March, and that hosts a lot of physicians throughout Northern Colorado. And we found that as a good way to kind of bridge that gap, getting information out about MAT services and just connecting it to those physicians so that they can disseminate to their patients. We also provided them with Summit Stone merchandise and contact information for referrals. And in the future, we're hoping to track the number of clients at the MAT clinic before and after our presentations. We have another one planned for August to hopefully reach more physicians. And then we also have these QR codes that you can see up there that we're hoping to pass out to clinics and shelters, which give really quick access information about safety and how to get access to treatment. And our vision is to just continue this collaboration and help bridge this gap in our community.
We're lucky to have a lot of guidance from Dr. Frank Reed, who's on Zoom all the way from Montana, I believe. And, you know, one of the things he told us was don't reinvent the wheel, use the resources that you have and try to help lift them up and get them out in front of people so they can actually be utilized. So thank you, Dr. Reed, and to the Alumni Association and Innovation.
Thank you, guys. All right. Our last project here, Senior Storybook Project.
Hi, everyone. I'm Lynn. I'm a fourth year medical student.
And I'm Valerie, also a fourth year medical student.
And the Senior Storybook Project is really a continuation of a project that was started by Drs. Blumen and Dr. Shara, who were also students at CU. And when they were fourth years, they wanted to spend some time interviewing patients at the seniors clinic and putting their stories into books. And so they've been really passionate about the project. They started this back in 2019. And since then, I've been kind of doing more of what they're doing. This year, we got a bunch of medical student volunteers and we paired them with 14 different patients from the clinic. We've had a bunch of different stories from like war veterans to couples who've been together for 50 years. And so getting to know all of these patients and putting their stories together has been really cool. And we just published our 4th volume, which is what you see right here. Our theme this year was gratitude. We just thought that coming out of COVID, that'd be a nice way to bring all of our patients back together. And we just had our 4th book reveal ceremony right here in this room.
Oh, whoopsie. Oh my gosh. Sorry, guys. So just like for like a little more context on the project. So Lynn here is interested in geriatrics. And so this was a very personal interest for her. And then for us, I think it's important to recognize that, by 2050, a lot of the population is going to be age 65 and older. We're going to be dealing with a lot of aging populations as healthcare providers. And, with this population, there's a lot more vulnerability in, social isolation, loneliness, and especially with the COVID pandemic, with what we saw. And so we feel like this project has a really deep-rooted foundation in just humanism and connecting with our patients and community. And so just as Lynn said, we had a book reveal ceremony in this room that I think we had some really good feedback from. A lot of our patients told us that it was really cool to, meet some of the other patients that were involved in the project, but also understand kind of the holistic perspective of this project of how our communities connect with each other. And so with the innovations grant, we want to continue to expand this project in a lot of different ways. We want to, right now we're only partnered with the seniors clinic at the university hospital, but there's aging patients in all hospitals. So we're hoping to maybe expand this to the VA, to the palliative care department. We also want to open up research opportunities, with maybe for MSA projects for medical students with insight into satisfaction scores and impact on our geriatric patients, and then continue to collaborate with different communities on our campus, such as the Center for Bioethics and Humanities.
Thank you all so much. All right. So as I said, those were our most recent winners. We look forward to hopefully hearing from all of you again next year at this event to see how the progress has gone over the year. We're now going to hear from our, upcoming grads from this program, if we have grads at all, but these were our 2022 to 2023 winners who have received this money over the last year, have really taken initiative on their projects and gotten things moving. And we're going to hear about some of their successes, some of their struggles, what they learned from their projects, and where they hope to take them in the future. So please join me in welcoming them. For our first group, we'll be hearing from Jess Safey.
Oh wow, you guys condensed it. Okay. Okay, so my project was titled Assessing Post-Resettlement Healthcare Needs for Afghan Evacuees in Colorado.
Could you go by the mic?
Oh,
Just so the people online can hear you as well.
sorry guys. So essentially I helped start and create the first Afghan evacuee clinic at Denver Health with Dr. Young. And that was kind of the basis of a lot of this idea and work, and I'll touch more on it. So just as a background, I'm going to Med Peds at Baylor College of Medicine, really interested in working with refugee and immigrant populations. My father's from Afghanistan and my mom's from Venezuela. And that kind of personal background story also got me interested in this work. So a lot of what I saw in the clinics after basically after the post US withdrawal and the resettlement issues that we had here in the United States, I worked a lot with the resettlement agencies, but also with Denver Health to create resources for the recent arrivals. And what I noticed after all the clinics had been completed is that there was a lack of materials both in Dari and Pashto. And so what I wanted to do with both Hasna Yassini and also Rachel Wessner was create these resources for the recent arrivals so that they have something that they can reference and understand. And a lot of it had to be very visual because not all Afghans are literate. So it really just depended on the group, the person, but it was a very visual project that I helped create. So the goal was to create these resources, both generally about the US healthcare system, and then more specifically about Denver Health, Stride, and Clinica, which were the main clinic sites that refugees or evacuees would actually get assigned to. Okay, so I guess I'll talk a little bit more about this with barriers, but we got a lot of the information and resources we needed to kind of get the project going. It was a little bit slower than I would have liked, but we basically created the overview videos both in Dari and Pashto. We did the focus groups both with Pashto speaking refugees and Dari speaking refugees. And I worked with the resettlement agencies to host those focus groups and got some feedback regarding the drafts that I had created. And I incorporated that into the overview videos. And so those have been launched now. And so what I'm working on right now is the content has been created for the Denver Health specific videos, the Clinica videos, and the Stride videos. And I have time scheduled with the interpreters to just get those recorded. And the next step will be to get them to the resettlement agencies, have them actually test it within the initial meetings that they usually have with their evacuees, refugees, and launch it both on YouTube and with the clinics. Mostly this will be with the resettlement agencies because they do a lot of this work in terms of education. Okay. Some of the challenges that I faced were funding, actually. So I actually had to work with an interpretation company to get them to use the funds to pay the interpreters. While I knew them personally, that was kind of a big hurdle to get like a PO set up and go through that pathway. Timing was also an issue. So interpreters were really busy with with court interpretation, clinic interpretation. I had to work with basically with their schedules and getting everything with the focus groups ready too, because I didn't want to inconvenience any of the resettlement agencies. So I actually had to work with their scheduling and their timing to see when there would be a large enough group, both in Pashto speakers and Dari speakers, to launch these videos. And then another thing was the content creation. So we had to constantly revise the content to make sure that it was that it was understood by someone coming to the United States as a new arrival, but also reflected what the organization also wanted to be portrayed in the videos as well. I also had to learn a new programming system, which was a very fun process to create more. So my goal was to create something very visual because I couldn't necessarily, not everyone's literate in Pashto or Dari. So it had to be very visual. So I used this animation system and I learned how to program everything. So that was probably the hardest part of the whole project in terms of getting that programmed, but it works really well, and it's still going to be used in the future as I create the videos in Pashto and Dari. And we have everything scheduled now for the Pashto videos for May 13th. And then the Dari videos are happening in the next few weeks. So yeah, and then the next steps for the project will be working with an MS3, which is Hasna Yassini. She's also Afghan. So she's been working on the project with me throughout the year and will continue to work on this project when I leave. Yep.
Yeah, were there any questions for Jess before we go on to our next group?
Hi. Yeah, so the question is like, what sparked this idea, like why I created these videos in particular. So I did actually a lot of work with the resettlement agencies, kind of like crazy third year, but I did a lot of worked within the communities, was on call for a lot of the resettlement agencies when the arrivals came in and had questions about different resources with the healthcare in the Denver metro area. And that's where the idea came from, just because of the fact that like, I knew the information wasn't getting out. I knew people were calling me left and right to get the information, and there just wasn't enough available, like information available. Like a lot of the resources that Denver Health was creating was all like written, nothing really auditory or visual. And the state right now is working on that as well. But it hadn't been launched, and it still has not been launched. So that's why this project was so important to get going with. Any other questions?
How people might be able to like refer patients to this resource? Like, do you have a YouTube handle or something like that that I can tell patients to look up?
Yeah, so the idea is, so every evacuee and refugee newly arrived actually goes through a settlement agency, one of the three and I have connections with all three. So the idea is that they will be able to get it through the resettlement agencies. So the thing about going through the organizations and one of the challenges I face is you have to go through more of a bureaucratic approval for the content, and it takes much longer. And we just didn't have that time to get the information, this critical information out. Eventually, I would love to see it like working with Denver Health in particular to get the information out. The state ideally wants to do this as well, which is something more auditory as well, but they didn't have the idea of creating videos. It was more of like a text message audio essentially. So that's why this was more visual in nature and easier to navigate for people. Any other questions? Right. Okay.
Thank you so much. It's just really cool to hear about these projects now that they're taking place. All right, our next project is the blood pressure management project. I believe I saw our crew up there. Yeah. Great, thank you.
All right, good evening, folks. My name is George Burnett.
I'm Yaz.
And I'm Carson.
So we are all third year rising fourth year students here at the University of Colorado. Want to give a big thanks to the Alumni Association for making this project possible, and also a huge thanks to our faculty mentor, who's Dr. Heather Cassidy. For those who don't know Dr. Cassidy, she's one of the co-directors of the Colorado Springs branch LIC. She's the director of the community engagement division of that LIC. So she's kind of a rock star in our eyes when it comes to this kind of work. The project that we came up with was to improve access to primary care for our folks living right in this neighborhood around us. So we know that the University of Colorado, the School of Medicine, and the UC Health System is a beacon of health for the whole state of Colorado and for the nation. But we thought that it was kind of a shame that, just a brief needs assessment demonstrated that our neighbors right here around us had pretty poor outcomes when it came to things like screening, follow-up with primary care, management of chronic conditions such as diabetes and hypertension, which is where we got the idea for this project. Do you want to talk a little bit about how we started out?
Yeah, sure. So we started off with a grant from the Slay Community Health Project earlier, I think it was 2020, and basically started with talking to the community and kind of driving down Colfax and asking around with barbershops, nail salons, and really seeing if they're willing to partner with us. And we found that a lot of people were really happy to kind of get some attention from the medical community. I feel like there was multiple barriers from like cultures to financial barriers, and just being in the community, we were able to see that need, and we distributed multiple blood pressure cuffs from that grant to barbershops. And then using the money from this grant, we were able to kind of expand and get more business partners working with us, along with expanding into giving posters out that have more people that are waiting for their haircut or to get their nails done involved in the project. So here's some pictures of us working with some of the community members. And this particular picture was like when we're going in there talking to the people at this barbershop, they wanted to get their blood pressure checked by us like right there. So we're like, okay, you know, let's give this a try. So that kind of showed that a lot of people are actually really open to it, and we just needed to, you know, introduce it to them. And the other things that we've done is expand to all of these other places kind of shown. I don't know if this laser works, but here, and here's some of the places that we've been able to partner with.
Not live, no worries.
Oh, okay. And then we've also built a website so that way people can see what their blood pressure reading means and have like different options to treat it. So we have a link to the student clinics in the areas, as well as cookbooks and information on the DASH diet. So that way there's like a different way to kind of work on blood pressure for different populations.
Mm-hmm. Yeah, and I'd say, like, at least in my eyes, one of the best parts of this project has been kind of developing this partnership and this community over time. So this is a longitudinal project for us. So every so often we'll go back to each of our partner sites and we'll kind of assess how the project is going and try to figure out in real time what's working, what's not working, how can we improve this to make it more accessible to reach more folks. And I was down in Colorado Springs for the last year, so maybe Carson can speak a little bit to some of the things that we uncovered when we would go back and talk to these barbers and nail salon owners, some of our partners.
Yeah, so pretty much right off the bat, we realized that our English poster was not going to cut it because most of the clients in these barbershops and nail salons did not speak English. So that was our first step, was go reprint all the posters in Spanish and make a Spanish version of the website. We have gotten a lot of feedback on our poster size. So Yaz is holding a very small poster here. We got feedback that nobody was looking at it, nobody could see it. So we made much bigger posters. One other thing that we kind of realized while we were in the salon one time was that not everyone actually knows how to use QR codes. Because they said, oh, well, how do I get more information? We said, oh, just scan the QR code. And they were like, we don't know what that is. So kind of also putting the website URL on the poster, I think has helped. I think
we have another slide after this one.
Yeah, so here's like a picture of the website we made. And like I said, it has information on where to get care, as well as different lifestyle recommendations for people to access after they get their blood pressure reading. One of the main reasons we did this is because we wanted to take away the barrier of having a health professional there. So the blood pressure cuffs are electronic and they're able to find information and use it without having like the pressure of someone from the medical community in that area, because I think that kind of is a big cultural barrier depending on what community we're in. And then we also, like Carson mentioned earlier, we kind of ran into realizing that a lot of people might not be able to use QR codes, and then also there's a language barrier we didn't expect, so we were able to make the website both in Spanish and English. But as time goes on, I think we're realizing that there's a lot more cultures, and that's not going to cut it. So we probably And here's some of the things that we talked about that we ran into. So there's accessibility to our to the posters themselves and the website, and then building trust was a big thing for on Colfax. We didn't want to seem like we were, going in there trying to change everything. And sometimes people think that they have to pay for the blood pressure cup, and so kind of taking the time to explain what the project is and getting the owners on board so they can really push it for others. And then we had one cup that actually walked away, which is a funny story, and I'll let Carson talk about that.
Oh, we just got feedback from one of the shop owners that his customer kept coming back in every day to use the cup and then decided he wanted to take it home so that he could have it for himself. So we're gonna work on getting that back. But that's the only one that has gone missing so far, which I think is a success.
Yeah.
I was expecting that maybe more of them would disappear.
And now we know there's at least one individual who has an incredible increase in their access to blood pressure screening. We have another slide that's next steps.
And then here's kind of our thank you. And here's a picture of us with a new barbershop that we just got added like a couple weeks ago.
Yeah, so this is going to be an ongoing effort for us. We're going to continue to expand into more venues, both along East Colfax and some other neighborhoods that we've identified nearby. One of the things that we're really excited about is that we just received IRB approval to study some of the outcomes from this project, because we thought, it's great if we are getting, anecdotal feedback when we go in that people like the cuff and that it's helpful for them. But we wanted to try to find a way to actually quantify that impact. So some of the things that we're going to be studying based on this approval that we have, we're first going to be looking at the cuffs themselves. So the cuffs store up to 200 readings, and we can transmit those via Bluetooth to an app where we're able to put them all into Excel and run stats on those. We're also going to be looking at metrics from the website utilization. So that's going to be, how many people clicked on the cookbook, what was the rate of referrals over to the Dawn Clinic. And then we're considering kind of running some semi-structured interviews with our community partners so that we can perhaps do a qualitative analysis, that we can kind of get a better idea of what's working, what's not working, so that if other folks want to try to replicate this work at other institutions, or we're looking for ways to make this an even stronger program, we'll have more than just the numbers. We'll have some of the why and not just the quantitative stuff. That's enough. We'll take any questions.
Great. By the way, do you have any idea among the patients that you get blood pressure? How many of them have high blood pressure undetected before? So newly diagnosed based on your efforts.
Right, that's a great question. I think one of the difficulties that we ran into is that we don't identify the patients. So it's hard for us to know like who exactly got their blood pressure reading. So we're not sure what their histories are, but we have, like George said, started collecting those blood pressure readings, and we don't have the stats yet, but that's one of the things that we want to see is what is the average blood pressure reading, and has it gone up, down, with like multiple readings. And the idea is that if someone comes to get their haircut somewhere, they usually come back so they can get their blood pressure checked multiple times, and that just empowers patients to know what their blood pressure is.
And I'll comment that we also have a survey. So as part of the IRB that just went through, there's a brief survey. It only takes like 30 seconds to complete, but it asks things like, do you have any underlying medical conditions? Do you take any medications for high blood pressure right now? Do you have a primary care doctor who you're seeing regularly? So we think that as we have some of that survey utilization information come in, we'll be able to answer that question a little better.
Might have mentioned this, but I'm just wondering, so like if I was walking in and I had no medical training, I might not know what high blood pressure was. Is there a way that they can know like, oh, I should follow up with this, or oh, that's fine?
Yeah, so we have a poster that's right next to the cuff, and it kind of has a chart being like, this is normal, high, very high, and then like a recommendation to follow up with a doctor. Like if you were in this category, that's not good. But it's also hard to, know exactly what people are doing with this information.
great project. When you guys realized you needed more language resources, did you like pay an interpreter service to translate your posters, or do one of you just speak Spanish? How did you guys do that?
Oh, we actually didn't do either. So we do a little bit of like kind of interpretation, and Carson knows some Spanish, so we use that as help. But I think like as we move forward, we would want to have students maybe that speak Spanish and speak languages that we're seeing in the community. That way they can communicate a little bit better.
Thank you.
Thank you, guys. Just a quick note for those of us who are on Zoom. If you do have a question as well, please feel free to unmute yourself and ask it. We should be able to hear you here in the room. Right, our next project, the Grief Anthology Project. I'm so sorry. I guess we will have to move on to the next one. And we will be giving you guys a link to these slides. So everyone, if you would like to look through them later, we certainly can. There's a lot of them. All right. So we'll do our YHC Clinic and CU Street Medicine project. Please join me in welcoming everyone.
So, my name is Kira. I'm a registered nurse and alumni. CU Anschutz College of Nursing.
And I'm Becca. I'm a rising fourth year med student.
We founded the CU Street Medicine program back in 2020. And this is our second time receiving the Innovation Awards grant, which has been super helpful in getting this project off the ground. Some background information, just as to like why this is important, is if any of you have like worked in hospitals and clinics, you will see a lot of folks experiencing homelessness, and like recurrent patients revisiting and like not having the same tools to be able to resolve their health issues and prevent health issues as the housed population. Some of these statistics are pretty significant. People experiencing homelessness have a life expectancy around 30 years younger than the housed population. And there are around 7,000 folks experiencing homelessness in the Denver metro area. And that was from a 2022 survey on 24 hours in January. So that is like a January day count as opposed to like a summer count, which in my opinion, this is like a severe undercount. But with that being said, it's great data for the people that we do get to survey. And 20% of the people in the point in time survey reported they have a chronic health condition, and 30% reported they have a just chronic disabling condition.
Yeah, as Kira said, this is our second time getting the grant, so thank you. And this was actually, last time we got the grant was actually our first grant, and we now have received nearly $20,000 in grant funding through various sources. So just like really big shout out that this got us off the ground to begin with. So some of the challenges that we faced were that we kind of had a big idea, but didn't necessarily have the connections to back it up. So we currently partner with 2 different cities and social workers in 2 different cities. And the police departments in both cities are how we made those connections. So that was helpful. The Street Dog Coalition provides free veterinary services for our unsheltered pets, which has been super awesome, and was like an awesome way to get people to engage with us. Yeah, and then Thornton and Commerce City. And then we also partner with the National Street Medicine Institute, and we're recipients of the inaugural SEED grant for promising street med programs 2 years ago. So our locations we currently have about 3 to 5 street outreaches a week in partnership with our social workers. And so the social workers can't go out unless our students are volunteering with them. And so we fill those slots with Anschutz students, which has been awesome. And then in addition to that, we host pop-ups. And so Kira, as a nurse, is able to go on the street outreaches, but we can't always get a provider with prescriptive authority there. And so instead we have pop-ups so we can get a few more people for each hour that someone with prescriptive authority is there. And so that's when we partner with people like the veterinarians as well.
So what are so we do, outreaches and then pop-up clinics, and the pop-up clinics are, like street medicine traditionally, where we are literally walking around Commerce City and Thornton with a backpack, with an outreach worker who has, significant rapport with everybody there. So, initially there was concern with like, oh, if it's a new student or a student volunteering for the first time, they don't come back, like what about the longevity and like, the connections. And, ideally, once people start to volunteer, they'll come back, once a month. And you see the same faces, get to know folks, people start opening up once they know you more. But having our outreach workers, who are like full-time employees of the city, and it is like their literal job description to outreach people experiencing homelessness, has been like a huge way for us to kind of jump that barrier in terms of like having trust with clients and patients. And I, as a nurse, I go out like every other week. It's like a wonderful way to, get to know people in your community, totally dissolve all the stigmas about people experiencing homelessness. I bring out students a lot with me. And, if other providers are interested, they are absolutely welcome to, work within their scope on an outreach. And the pop-ups are cool because they happen at resource fairs traditionally. So, we are not the only service at these events. So like there's food pantries, laundry trucks, shower trucks, veterinary services, sometimes public health department is there doing vaccines. We are doing kind of like primary care screening and education and like basic medications and refills and everything for people, wound care, foot care, all that kind of stuff. So it's been like a lot of creativity in like thinking of like, how can we maximize the care that we give to folks, even though it is like somewhat limited in like not having a brick and mortar clinic.
Yeah, and also just to clarify, the funding for this grant all went to us being able to provide foot care services, which if anyone has ever worked with the unsheltered community, they know is like probably one of the most, if not absolutely the most appreciated service. And we're now doing foot care clinics, and it's something really special that we can do that otherwise they wouldn't have access for. So just some statistics for 2022, and we're on track to probably over double all of these statistics this year. But we had nearly 40 unique volunteers, including 9 licensed providers who volunteered with us, over 600 hours of direct community volunteering. So that doesn't include like all the organization hours, admin hours, that's directly with persons experiencing homelessness. We joined or organized ourselves over 85 outreaches, including 12 medical pop-ups. We're definitely going to get at least probably 2 or 3 times that number of pop-ups this year because we're on quite a roll. So yeah, that's been really exciting.
These are some photos from our recent pop-up clinics. And there is something we should explain. It gets confusing because CU Street Medicine is a student group here at Anschutz. And when students come volunteer, they are volunteering underneath YHC Clinic, which is a local nonprofit that provides all of the funding and the liability for the students volunteering, as well as providers liability. So the other cool thing is that we can be interdisciplinary. We are trying to like branch out into like dental, huge need, physical therapy, there's a huge need, getting more PA students, public health students, social work students would be awesome. But yeah, it's just like a really cool way to get to connect with folks. And in our orientation for students and providers, we have like a survey that's kind of embedded in there. And one of the questions is like, do you feel that you receive like enough curriculum from Anschutz on like this patient population? And most people feel like they don't get a ton of education on specifically people experiencing homelessness. And even more so, people feel like they don't get clinical exposure to people experiencing homelessness or like caring for this population specifically. And it is like a huge chunk of people in the hospital and clinics. So people are going to see it in practice eventually. And it's great to like start dissolving these stigmas early.
So if you're interested in volunteering or joining a student group, feel free to email me. That's my email. So yeah, I can get you in on the listserv. And yeah, we're always looking for new volunteers at any level of training.
I have a question for you. So this is in regards to volunteers. How many unique volunteers did you have there? Did you say 38? Did I get that number?
38.
Is that all students? Is that alumni? I know you said you were an alumna of the College of Nursing. What's the makeup of the volunteers?
It's majority students or local providers, like local licensed providers who may or may not have graduated from CU. But sometimes other people through word of mouth do hear about us. And so we welcome students. We've had students rotate with us from other schools as well, non-CU affiliated.
Yeah, if you're super interested, I can send you a breakdown. It didn't look great on the slide. It's just like a lot of numbers. But yeah, it's a lot of med students, a lot of nursing students, and then mostly doctors and nurses we've had volunteer so far.
Okay, we'll have to connect because we work with the alumni relations shop with the other schools and colleges for students. So happy to help and get the word out there for future volunteers.
Yeah.
I'm just curious to know what the experience is like and how it differs between when you're with like a licensed medical provider and when you're not. What kind of things can you guys help the population with?
Yeah. Oh, you got it. Okay. So it's a good question. So because we're going out with licensed social workers, so the social workers can't go out by themselves due to just like policies and safety issues. So one, just being like a physical presence. So even if a provider is not there, just being a presence is helping the social workers do their job. In addition, something that I myself have learned while going on social work rounds, and I've heard from a lot of other people, is that just being a listening ear is like really, truly, sometimes just showing up is so important. So for example, someone had lost her EBT food stamps card, and getting that replaced, if you've ever been on the phone with them, was a nightmare. And so me and the social worker and the, in that case, client, because it wasn't even medical, but we spent 3 hours on the phone with that woman, right? And we called so many different services, and like I was confused, the social worker was confused. And so, but that kind of stuff is like still what we consider like the real work, because that's something that just wasn't getting done. And this woman like truly wasn't eating in this case because she didn't have that. So we also help with things like getting people into housing lotteries. We're going to start distributing Narcan really soon. We have like dreams of sometime in the near future starting like clean needle exchanges and stuff, and just utilizing as much of that time on rounds to do as much as possible. And then, yeah, like anyone with a license can practice up to their scope. So we do provide the liability insurance for that. If you want to talk about challenges, talk to me about liability. But anyway, but so yeah, so for instance, Kira is able to do like amazing wound care, which actually nurses are like wound care wizards, way better than MDs in my opinion. And then versus when you're working with an MD, then it's more focusing on like, okay, do you have access to your medications? What medications have you been on in the past? How can we get you back on those? But also just like preventative health screenings and having slightly higher level conversations about like overall trajectories of care.
Yeah, students are also able to hand out supplies and stuff. So we have, like feminine hygiene bags to hand out, wound care bags to hand out, kind of like, food, snacks and stuff, body wipes, like trowels, whatever it might be. And then assisting the case managers with their work. So helping do VI-SPDAT assessment, which is like a vulnerability index tool used to put people into housing pools, food stamp stuff, getting vital documents. So it helps like as a medical student, just like seeing the system and like how hard it is to access these public benefits that ideally would be easy to access. And then it's like, you know, there's a million different barriers and we try to help navigate them as best we can.
Hi, this is Dr. Williams on Zoom. Tell me what you do about mental health. Do you have any mental health outreach?
Not yet. We've been trying to recruit some mental health providers. It is definitely a need. And like as a nurse, I can help de-escalate folks and refer to local clinics. And, you know, be able to recognize crises and, you know, screen for that kind of stuff. But to provide therapy on the spot, I am definitely not the person for that. And we would love to have kind of, you know, more direct service for mental health services and like being able to refill prescriptions, because that's a big barrier that we see for folks. But yeah, that's definitely something we want to grow in.
So I'm a former nurse, former family practice doc, current psychiatrist. So we should try to get together.
Awesome. Please email me.
Okay.
So you mentioned that you can do like basic prescribing out on the streets. What are the logistics like for ensuring follow-up and like refilling those prescriptions if like patients aren't actually coming in?
Kind of, we deal with that on a very much like case by case basis. And it also depends on the comfort of the provider. So just as a rule, we don't prescribe narcotics. So that's just kind of out to begin with. But then that being said, we do have like pre-filled pop-ups, like we have boxes of like prescribed controlled medications, not controlled, but like, yeah, sorry.
No controlled medications.
Yeah, no controlled medications, wrong word, but just like medications that are traditionally prescribed, but we already have them. So that way we can just fill them out. And then usually if there's, but you can usually tell when there's like a case where a patient is really going to need it. So that we have definitely had situations where like we've had student volunteers go and pick up the prescription and have paid for it and have made sure that then the social workers actually aren't allowed to give the medication out. So then in that case, the student goes out with the social worker and the student can physically hand the medication to the patient. And a lot of times we do have, when we're going to that length, like we do have longitudinal connection with that patient. So we have a way of ensuring that follow-up then.
Also as a nurse, like when I go on my street outreaches and stuff, a lot of times our medical director is willing to be on call. And so I'll, you know, meet a patient with a need. It might be a prescription refill or something, and I can do, you know, full history and physical assessment, and then call our licensed provider, Katie, talk through it with her. And she has actually been able to fill prescriptions for patients who have Medicaid, and they've been able to pick them up next day. And that's been like pretty huge, because, you know, it doesn't take up a lot of her time. And it, you know, this was a patient who was presenting to the emergency department every 3 months because she ran out of her inhalers. And we were able to get her 5 refills on her inhalers.
Thank you guys so much. All right, we have one more group here tonight. Oh, did I go too far? All right, please join me in welcoming him.
Hi, everyone. I'm Frances Vernon. I'm a 4th year med student.
I'm Jessica. I'm also a 4th year medical student. I'm Megan, also a 4th year medical student.
And we worked on a project working with people who use drugs and perspectives on accessing healthcare and general characterization of drug use around the Denver metro area. So 2 kind of high level background pieces that helped us sort of set the stage for this project. The first one just being around fentanyl and the fentanyl epidemic in Denver. And so, as all of you, I'm sure, are familiar with the headlines, drug overdoses have continued to climb. And like one stat we think was really interesting is Colorado is the 8th highest national increase in fentanyl deaths. And so we had a lot of interest in understanding more about fentanyl and what that drug sort of use looks like from people who use drugs in the Denver area. And the second piece is we had a report was done, a clinician survey by a couple of students a couple of years ahead of us. So what they did is actually worked at Denver Health and worked with providers to better understand what barriers providers were running into when they're treating people who use drugs. And what we were wondering about is what happens when you go and talk to people who use drugs, and how do those sort of the barriers that providers are facing relate to what the patients themselves are actually experiencing, to better tailor sort of interventions just to improve access to care and the quality of care people who use drugs receive.
They're a little Our rearranged. slides. Yeah. So in terms of what we've done, so we were able to collect 200 surveys that were partially funded with the funds that recently. We were able to verbally administer those surveys, that data, and we were able to compile all of those results.
Could you move just a little bit closer to the microphone? Thank you.
So we were able to compile all of the results into a 40-page report called the HRAC Participant Survey Report that was kind of meant to be the reverse of what our predecessors had created in 2020.
So one thing that we know is that a central tenet of working with the community is sharing the data that you receive from community members back with the community themselves. So we had the opportunity to go back to the Harm Reduction Action Center, and with some of our extra funding, we provided Santiago's burritos, and we got to share, got to share a brochure that we had made with participants and discuss kind of like what the findings were and what these findings meant to them. So they would kind of read some of the quotes and relate to them, and it was really definitely a highlight of the project for us.
So these are kind of examples of that report that we were talking about here, just a couple of the pages that summarized what we found. And then this next one is the brochure that we passed out at the community event too.
Yeah, and with our research, what we've been able to do with what we collected, so we finished collecting the surveys in October, and we're able to do some at least initial descriptive statistic work, and we submitted 2 abstracts to the National Society of General Internal Medicine Conference, which both were accepted. So we're excited to be able to present these posters next week here in Aurora at the conference. And so the first one just kind of highlights, if you go back one slide, just the people who use drugs, treating beyond the condition. So a lot of questions, which you obviously can't see sort of zoomed in here, but just how people characterize their experiences with different providers from different ways. So if you feel understood, if you feel heard, if you feel like you're able to be open and honest about your drug use, and just a few kind of also pulled quotes. We had a lot of interesting anecdotes from many different people throughout this survey. And then the second one was we looked at unintentional fentanyl use and associated harm reduction strategies. So one of the themes that came out of our data was understanding intentional fentanyl use versus unintentional fentanyl use. So folks who are wanting to go smoke fentanyl or inject fentanyl and actively using fentanyl versus some of you probably know we have a large methamphetamine problem in the Denver area, and there's a lot of fentanyl contaminated in methamphetamine supply, and so characterizing and understanding what that unintentional exposure looks like for folks as well.
And then just to kind of summarize like some of the future directions that we have regarding the report, we're working on distributing that to both the center that we worked with HRAC here in the Denver metro area, and as well as disseminating that to interested providers and to kind of bridge the gaps of where people who use drugs feel like their needs aren't being met when they do present for healthcare. We are also currently working on a manuscript that we hope to submit for publication, and we've also recruited the help of some addiction medicine colleagues who are advising us through that. And we are also very fortunate to have been connected with one of our colleagues in the Denver Health cohort. We were all in the Denver Health LIC, and we have a wonderful student in the year below us, and they're going to kind of we're going to pass on the baton, and they're going to analyze the data and present that information as part of their MSA project.
So some of the things that we learned were how when you're working in the community that you just really need to follow up with people, because these people have their own, priorities and agendas and full jobs that they're doing that don't actually relate to working with students. So just really following up, being persistent, and just really valuing those community members and their input to your project. Also persistence when facing barriers, based on our conversations with our the Harm Reduction Action Center. And did we actually introduce what that was? We did. Just to introduce it, it's a center in Denver that provides harm reduction materials to people who use drugs. Many of you are probably familiar, they're fabulous. So anyways, we had established with them that it was very important to compensate participants with a gift card to really value their time. And it was really a 20 or 30-minute survey. So but we learned that it's really difficult to fund gift cards with funds from the CU School of Medicine. And so that took a lot of persistence and a lot of emails. And we learned it was kind of like two lessons in tandem. Like when you value your community partners, it's really worth the extra work to honor their requests. And then just that partnerships matter. Our innovations grant mentor, Dr. Mooten, was incredibly helpful. She helped really, I think we were, maybe feeling discouraged, and she put a spark in our project that we're so grateful for. So thank you all so much. Thank you to the innovations grant. And I think our thanks. Oh yeah, here we go. So thank you so much to the Innovations Grant for this opportunity. This was such a fun project, and we're really excited about it. We also received a grant from the Slay family. Thank you to HRAC leadership and staff, Dr. Jennifer Adams, Dr. Melissa Mouton, Dean Zimmer, and Lisa Rayville, who were super helpful. And then Maddie Kim and Chi Anik Bogu, who helped us do some surveys. Yes.
What's next?
What's next? Okay, so we are working on publishing a manuscript and then passing it on to our MSRE Chi. They are going to work on coding our qualitative data. So we're going to probably publish some excerpts of what people have said, but they're going to work on actually working with a qualitative statistician to code the data and hopefully publish that to the data as well.
And I think our other big hope is that this very large report we put together, this is like for anyone who needs an MSA, we have a lot of data. And it was a very large survey. And I think what we're really hoping is that by engaging other public health officials and other folks in Denver like that work with this community day in, day out, it can provide a little bit of additional insight as we think about what interventions are working. So like one quick example is we found nobody is using test strips. Nobody used test strips to test fentanyl, very, very few. And so it's just a very interesting, I think, nugget for us to say we're investing a lot as a state in, a bucket of test strips work. Why, people should use test strips. We distribute a lot of test strips, but the fact that folks are not using them, like, why is that? And should we be allocating those funds to other harm reduction strategies that might be more beneficial? But we have lots of little kind of nuggets like that we hope to have going forward. Yeah.
Question. We don't currently have a plan to have someone redo the survey, though we do have a lot of lessons we learned. So I think that could be a really good, something to leave behind these are the things in our survey. This is what we learned from this process. This is what we would do different.
Yeah, like we think a huge piece that we left out is about people experiencing homelessness and sort of housing stability and status. Things like that, that I think would be really helpful just to, as we think about like how to better work with and provide high quality care. So I think there's probably partnerships with even groups in the room that we could benefit from, I think, combining the forces. Yeah. Well,
Thank you so much.
Thank you guys so much. All right, we have come to the end, my friends. I'm just so incredibly inspired by everyone in this room. You guys should just be really proud of what you're doing. As a peer who has not achieved nearly as much as any of you, it's really cool to get to be here and hear from you all about what you've learned, what you're going to be doing. I can't wait to see where some of your projects are going. Hopefully we get to hear about some of them next year when we have this event again. I'm putting that out into the world so that we continue this event. This is the first time we got to really gather all of you amazing people into one room and celebrate these types of projects and initiatives. And I hope that you all learn something from each other as well, both from other people's successes, what they struggled with. Maybe there were some similar struggles that you have with your own projects. And it sounds like a lot of really great connections were made too between some of our student groups, maybe some of our alumni who are both online and here in person. So hopefully in the future, we can kind of continue that connection and collaboration. Before we wrap up, I think Dr. Tuola, did you have a few more words that you wanted to share? And then we do also, just for everyone's awareness, have some goodies out front for everyone as a thank you for coming to our inaugural event to celebrate the Innovations Award. Thank you so much.
Thanks so much. Well, actually, I want to recognize Helene tonight for all of her excellent work on this project, and we couldn't have done it without you. So we have a gift for you. So thank you so much. We can take a picture. For you, yeah. You're welcome. Congratulations. Here, there's a fancy box.
This is okay. Yeah, that's good. Some of them have a klutz. Thank you.
Yeah,
That's so sweet.
Thank you for all your hard work and dedication to this project. It's really.
Small thing to say, it's been the part of my 4 years here to be a part of this project.
Awesome.
And honestly, just to see what everyone's doing with their award and, with their own motivation, because I certainly don't feel like I have the same type of motivation that seems to drive all of you. So really.
Congratulations.
So much.
Yeah. Yeah. Well, I just wanted to say thanks for coming, everyone, tonight. I think I'm really inspired to hear all that you're up to, and it's incredible to see like how many ways that you're getting involved in the community and how many opportunities that you're creating for yourselves and for the people who live around us and the partnerships that you have created. And I really think that this is also just an amazing example of all the things that we can do through the Medical Alumni Association. This started as an idea from a student and an alumni faculty member, and we just took it and ran with it. So think about your projects in the longer term, right? Come back to us if you want to create more programming for your project as a way to engage with students and alumni. This is an idea that just started as a conversation and now we're talking about $250,000 endowment that we're on our way towards. So it's a really awesome opportunity to harness the innovation of students and their excitement and energy and our amazing alumni network and all of the resources that we can support and provide each other. So I'm so happy to be involved with this. I'm really happy that you're able to come, and thanks so much for coming tonight. I think there's a survey that if you want to fill out, that would be super great. And let us know if you have more questions or other ways you want to be involved. Thanks. Have a great night.